Hello, good evening, sir. Hello, good evening, sir.
Hello.
Yes, sir. You can try sharing the screen.
Hello. Am I audible?
Yes, sir, you're audible.
Fine.
Uh, Good evening, viewers. I welcome you all on the behalf of Indian Medical College to this online class. Dear viewers, in today's session, we have a great speaker, our beloved Dr. Sohil Vadiya, who is Associate Professor from the Department of ENT from MK Shah Medical College and Research Center. He has several years of experience in his field and he'll be taking a class today on the topic Anatomy of Nose and Sinuses. Good evening and welcome, sir. It is an immense pleasure to have you here back to us. And thank you so much, sir. For viewers, if you have any doubts or any other clarification, you can just post them in the comment section below. And sir will clarify all these doubts at the end of the session. Sir, I request you to please start the presentation.
Okay. So we'll start the session now. Today we are going to learn about nose and the paranasal sinuses. What basically we are going to talk is we will learn the basics anatomy of the nose, external nose, the nasal cavities, the turbinates, and the paranasal sinuses. It is very important to understand that there are key areas in the nose where the sinus is open. These openings of the sinuses are very important for us because widening of these openings, they are called the ostium. So widening of an ostium of the sinus would cure most of the problems of the sinus. So at the end of the session, I would like all of you to please understand this much. Understand various cartilages and bones related to the nose and septum, mention at least various paranasal sinuses and their openings, and you will have to understand the importance of minimally invasive surgery for restoring the drainage of the sinuses. My name is Dr. Sohil Vadiya. I am from Dr. M.K. Shah Medical College, Ahmedabad. Welcome you all. Fine. So what is about the external nose? External nose is very important for our cosmetic appearance. And there are various components of the external nose. Very much relevant for plastic surgery, very much relevant for those who have professions where they have to work in front of a camera. Okay, I'm also working in front of a camera, but no, I'm not talking about my profession. You understand what I mean? Fine. So the upper one third of the external nose is bony, and it is formed by the nasal bones, frontal process of the maxilla. That's the frontal process of the maxilla here, this way. And the nasal process is of frontal bone, and in the midline, in the upper part, that's the frontal bone, and that is the nasal process. Okay, so that's a bony part of the external nose. There is also a cartilaginous part. So which are the cartilages? Basically, it is the upper lateral and the lower lateral cartilages. Lower lateral cartilages are also known as alar cartilages. There are lesser alar cartilages and Some part of the external nose is formed by the septal cartilage, this one. Okay, so that is the framework of external nose, very important. Many of the surgeries are done in this part. And the gap between the two cartilages, upper and lower lateral cartilages, is known as the Lyman Nasi. It has its own importance for various injections and blocks. Now we'll learn about the internal nose. There are two nasal cavities which are divided in the midline by the nasal septum. And each cavity has a lateral wall, medial wall, roof, and a floor. It's a whole room inside the nose. The nose is not as small as it looks outside. There is a big world inside. And there are walls and roof and floor. We'll learn in detail about them. We have to learn. So first we'll learn the medial wall, also the nasal septum. The nasal septum is formed by many components. It's not one sheet of particular material. It's many cards. It's a castle of cards, and those cards, they make up the nasal septum. Which are the cards? The nasal septal cartilage, which forms most part of the cartilaginous septum. Then there is a perpendicular plate of the ethmoid bone. Then there is a vomer bone. Vomer is a separate bone. It's not part of any other bone. Perpendicular plate of ethmoid bone is related to the ethmoid bone. And the crest of maxilla and the crest of palatine bone. So this much we should know. Some part of the septum is contributed by the sphenoid bone here, very, very small part. And some part here in the very posterior part. Uh, what we need to understand here is that whenever we are doing a septal surgery, we have to take into consideration all these parts. We have to give respect to all these parts, and we have to consider removal of the nasal septum in such a way that it does not disturb the actual framework of the nasal septum. Some part of the nasal septum contributed by nasal bones, okay, but very irrelevant during surgeries. So that is why if we want to create an erect nose, a nose which is not fallen, a nose which is not suppressed, a nose which has a proper shape and a structure, we need to preserve at least 2 millimeter of strip here. This strip, the cranial strip of 2 millimeter and an anterior strip of 2 millimeter, that has to be preserved in any of the septal surgeries. This L has to be preserved. Okay, that will maintain integrity of the nasal septum and prevent the saddle nose deformity. Now we'll understand the turbinates now. Now, what are the turbinates on the nose? There are three turbinates: superior, middle, and inferior turbinates. Middle turbinate is a part of the ethmoid bone. Superior turbinate is a part of ethmoid bone. Inferior turbinate is an individual bone. So inferior turbinate is bigger than all the two other, and they all are attached to the lateral wall of the nose. So the lateral wall has three attachments of the three turbinates, and the space which lies beneath the turbinates, which lies lateral to the turbinate, is known as a meatus. So there are three turbinates and three meatus, three meati. Okay, superior meatus, middle meatus, and inferior meatus. So the turbinates and the meatus has their own importance. We'll see in detail. We need to understand, we need to learn here what opens in which meatus. So the maxillary sinus, you can see here. Maxillary sinus has opening in the middle meatus. Similarly, the frontal sinus has an opening in the middle meatus. These are anterior ethmoidal air cells. Now, the ethmoid sinus is not one sinus. It's a bunch of many air cells. And these air cells are divided into anterior and posterior groups. So anterior group of ethmoidal air cells open into the middle meatus, whereas the posterior group of ethmoidal air cells open into the superior meatus. So this is another picture to show you the turbinates, the meatai, and how they are oriented inside the nose. This is all a part of the lateral wall. Now we understand that in the middle meatus, so many sinuses open up, and that's why the middle meatus is known as the key area of the nose for endoscopic sinus surgery. So this key area has also different um, projections, crevices, and some of them are named, some of them are not named. So the most important process in the middle meatus is known as the uncinate process. It's a bony process, bony projection, leaf-like bony projection. So behind the uncinate process, posterior to the uncinate process, is something called a bulla ethmoidalis. Bulla ethmoidalis is an air cell basically belonging to the anterior ethmoid group of air cells. It is the largest of the anterior group of ethmoidal air cells. So bulla and uncinate, between them two is something called hiatus semilunaris. So, uh, and as we understood that in the key area there is an opening of maxillary, frontal sinus, and anterior group of ethmoidal air cells. We need to understand at least two things: uncinate process and bulla ethmoidalis, and the hiatus semilunaris in between them. Fine. So what we understand in this picture is that the maxillary sinus has a very narrow ostium. You can see here the sinus is quite big. It has a capacity of 30 ml, and here the opening is very small. Uh, it opens into the middle meatus. So any disease affecting the nose, like allergy, infections, tumors, polyps, if they cause swelling or inflammation in this area and they block this particular area, then the sinus will not have any place of opening. And then what will happen? The sinus will not have a drainage. The sinus, where the lining is of respiratory mucosa, which continuously secretes some amount of mucus, will be accumulated into the sinus. And this mucus will be converted into pus later on, and it will be a stagnant fluid into the middle, into the maxillary sinus, which is known as sinusitis. Which is the problem with sinusitis? In the inferior meatus, we have the opening of nasolacrimal duct, the duct that drains the tears of the eye. And in the superior meatus, we have opening of the posterior ethmoidal air cells. Okay, this slide is very important. I want all of you to please understand what is a respiratory epithelium. It is a pseudostratified ciliated columnar epithelium. It has the epithelium which has cilia on its surface, and these cilia beat into the direction of the ostium of the sinus, of our paranasal sinuses. And the same mucosa is also into the nose, where they beat into the posterior direction towards the nasopharynx. The mobility of the cilia is very important. Um, there are certain genetic disorders where the mobility of the cilia is affected. There is something called a congenital immotile cilia syndrome. There is something called a cartilaginous syndrome. So the point here is that it's very important that the cilia has good mobility for the drainage of the sinuses. Now, okay, one slide for the sphenoid sinus. See, sphenoid sinus is the most posterior sinus. It's just above the nasopharynx. Okay, so what happens? Diseases of the sphenoid sinus can cause a headache, and this headache will not be felt onto the frontal area, but it will be felt posteriorly. So, posterior headache. One of the reasons for posterior headache is a sphenoid sinusitis. Another important thing to learn about sphenoid sinus is that sphenoid sinus is related to a carotid artery and optic nerve. Okay, so we understand here that the sinuses are situated in such a way that the orbit is lateral to the ethmoidal group of sinuses. Okay, and that's why when we trace this posteriorly, we can understand that the optic nerve will be related to the most posterior of the paranasal sinus, and that's why the sphenoid sinus is intimately related to the optic nerve. That is why it is very important for all of us during endoscopic sinus surgery that we respect the sphenoid sinus, we respect the relations of the sphenoid sinus. And one of the complications of endoscopic sinus surgery is injury to optic nerve. The incidence is 2%, maybe less than that, because we are very careful. Okay, this is another picture to show you the middle meatus, the key area. Uh, a diagrammatic representation and also a CT scan picture. Many of you in your practical exams will have a CT scan and you will have to identify the structures here. So this slide is particularly taken to make you understand which are the structures that you need to identify in a CT scan. So I'll narrate few of them. So that is a maxillary sinus here. This is a maxillary sinus, and that's in an ostium of the maxillary sinus. Okay, similarly on the left side. Okay, this is a coronal view. This is a coronal view. Okay, very important that we see two turbinates here. That is the inferior turbinate, which is grayish in color here, and that is a middle turbinate, which is attached to the roof of the nasal cavity here. Okay, when you take posterior cuts, we may be able to see a superior turbinate as well. We understand that lateral to the middle turbinate would be the middle meatus. Here we see an air cell here, must be an ethmoid group of air cell. Okay. And the nasal septum, which is almost straight in this case. Okay. So nasal septum, maxillary sinus, inferior turbinate, middle turbinate, ethmoid group of air cells. Okay, the roof of the nasal cavity, which is formed by cribriform plate of the ethmoid. This particular projection of bone is known as crista galli. The orbit and the eyeball and the extraocular muscles. Okay, that's too much of information. Just remember this maxillary sinus, ethmoid group of sinus, two turbinates, and the septum. So this picture generally tells us what is happening in sinusitis. Basically, sinusitis is the result of blockage of the sinus ostium, and the blockage of sinus ostium is because of could be allergic, infective, trauma, tumor. Sometimes could be irrelevant inflammations. Okay, that is very important here. All of us to know that how actually the nose looks in an endoscopic view. Nowadays, we are doing almost every surgery by endoscopic assistance. Now, gone are the days where we used to use the nasal speculum and the elevators and the headlamp, and then we used to do the surgeries. Even septoplasty is done nowadays with the help of an endoscope. So, in this picture, we see the middle turbinate here. Here is an inferior turbinate on this side. We can easily understand that the inferior turbinate is more bulky than the middle turbinate. These are normal turbinates, they are not enlarged. Okay, so this is just for the sake of all of you to see a picture. Fine, so there is something called a concept of functional endoscopic sinus surgery, which is that you widen the ostium and provide natural drainage to a sinus, and all the troubles of the sinuses will be taken care of by the mother nature. So our job, a surgeon's job, is to identify the ostium of a sinus, widen it so that the sinus will have a proper channel for drainage, and then the sinus would ventilate very well, and then that would cure most of the problems. But this particular thing is not so easy. There is a learning curve about it, and that's why extreme care and skills are required. The orbit is nearby supralaterally, the skull base is superiorly, the hard palate is inferiorly, and the nasopharynx and carotid artery posteriorly. So extreme care is required to prevent injury to any of these structures. Thank you. So in summary, what we learned today is that this is something called an external nose, which is formed of cartilages and bone. There is something called a nasal cavity where there is a lateral wall, the medial wall. Medial wall is formed by the nasal septum, the roof and a floor. The floor is formed by the hard palate. In the lateral wall, there are three turbinates, and the key area is the middle meatus, which is lateral to the middle turbinate. And in the key area are the openings of the maxillary sinus, frontal sinus, anterior group of ethmoid cells. The concept of endoscopic sinus surgery or minimally invasive sinus surgery is to open up the ostium, widen it so that a natural drainage will be provided to the sinus, and then that would cure most of the problems. Thank you very much.
So we are done. Sir, am I audible to you? Sohil sir? Sir, am I audible to you? Okay. Thank you so much, sir, for such a wonderful session. I hope students and viewers would have enjoyed the session. And please spread the word to all your friends so that everyone get benefit through our videos. You can share our YouTube channel with the link given over here, and you can also share our Facebook page. So you can also access the recorded videos, MCQs, and announcement for all the session will be made at our Facebook page. Thank you so much. If you have any other queries, you can put them in the comment section below, and your queries will be clarified later. Thank you. Stay tuned and subscribe to our YouTube channel, and you will be reported regarding the next sessions. Thank you.